I have diabetes in my family. I do not have it, but I have several family members that do. And we're all a family that likes to eat, and that's what I think about when I hear the word diabetes. Oh, you're so restricted now to what you can eat. And also I've had family members that have had severe problems with diabetes, so there is a worry there.
Mm-hmm.
Sores that do not heal and things like that.
So you've seen that?
I have seen it.
In your own family. So do you have concerns for yourself?
I do. I have more concerns about my son. I always have him checked when I notice that he drinks too much or wants to lean more toward the sweets.
How old is he?
He's 21 now.
Okay, so you're still keeping an eye on him.
I still have to. It's just a motherly instinct. I still want to have that blood sugar checked.
Does he control his weight?
He does.
Okay, so you're just a worried mom.
I am.
Okay.
When he starts telling me that he's tired.
Mm-hmm. But for yourself, you're not worried?
I'm concerned, but I'm more concerned about my family.
Okay, I hear that. And so the experience that you've had with diabetes has largely been around your own family members.
It has. My father is a diabetic. He has sisters that are diabetics, and his mother was a diabetic.
And on your mother's side?
On my father's side.
Okay, is there any diabetes on your mom's side?
None on my mother's side that I know of.
Okay. And how's your dad doing now?
My dad is controlling his. He walks, and he tries to watch his diet. He likes the sweets, but he tries to keep it under control. So
Mm-hmm.
he has to take medication for it.
Mm-hmm. And how long has he had the...
He's had it for probably about 8 years now that he's known.
And but he's doing good.
He is doing great.
What do you think causes diabetes?
Not enough exercise is what I feel like the biggest problem is for our family.
Mm-hmm.
We're not in the habit of exercising and becoming overweight. Like I say, we like to eat,
Mm-hmm.
and we don't eat the right foods, lots of fatty foods, sugars.
Have you tried to make any effort to change that?
I try, and it lasts for a while, but I fall off the wagon.
That's probably a typical story, isn't it?
It is.
Do you think that there are risk factors for diabetes?
Yes. The risk factors, I believe, sometimes can be hereditary. Or I think it's known that it is hereditary.
Mm-hmm.
That's why I have a lot of concern about my son.
Mm-hmm. Mm-hmm.
When I see things in him.
Do you see him following in your footsteps as far as his eating patterns?
Yes, ma'am.
Well,
I'm
that
afraid
happens.
that's a family trait that we do all like to eat.
Yeah, yeah. When a person does have diabetes, what kinds of things do you think are important that they do to control that disease?
Again, cut down on the sweets, the fatty foods, really watch the diet, and walk, lots of exercise.
Now you said that your dad and his sisters, so several people, so you all get together for holidays?
We do. Not all of the family anymore. My aunt has since died.
Okay.
And it started with a complication from diabetes.
Mm. When you get together though for holidays, and
we don't watch the diet. We eat the normal holiday foods that we shouldn't eat.
Mm-hmm. Mm-hmm. Think you have a bigger concern about that at the holidays or just on ordinary days?
Ordinary days.
Yeah.
The day-to-day. The way we've always grown up cooking.
Mm-hmm.
The southern foods.
Mm-hmm.
Everything fried. Big problem.
But what tastes good though, doesn't it?
Yes.
It does taste
And
good.
I've learned if it tastes good, spit it out. Because it's not good for you.
What roles do you think family members play in helping people that have diabetes?
The support.
Okay, can you give me some examples?
As far as the person in the home that cooks, responsible for cooking foods that are healthier.
Okay, so when your dad was diagnosed with diabetes, did your mom learn to cook different?
It's my stepmother, and yes, she has. She's learned to not cook the cornbread with every meal, and more baked foods instead of the fried. She has made a big effort to help with that. He also had a problem later on with his heart, and he was told that that could have been caused from his diabetes. But it does cause you to have heart problems.
So let me go back to the idea of how families support somebody. What kinds of things do you do to support your dad?
I'm not around my dad as much now, but I do always ask the questions, are you walking? Are you trying to stay on your diet? When we do get together, are you sure you should have that piece of cake?
So,
Reminders.
Okay, so what's the difference between reminders and nagging?
Pushy. Continually, every time, not saying, well, you can have half a piece of that cake. Try not to eat all of it.
So that you would say that?
It's a fine line.
It's a fine line, yeah. In what ways do you think friends or neighbors or maybe coworkers can assist someone that has diabetes?
There again, urge them to go walking with you, and I'm not a very good example because I don't exercise like I should, and I don't stay on the diet that I should, but co-workers trying to work together to help each other on a diet.
Do you work full-time? Or?
I do.
And what kind of work do you do?
I'm a circuit clerk.
Okay. Here?
In Winston County.
And so do you all take a hike at lunchtime together?
No, we don't. We usually have to stay in the office. We do get out one at a time, but there's not a time that we can all get together. Now, in the past, we have tried to exercise together. It helps to have a support group.
Yeah. How about after work?
We have exercised together after work. We've planned on walking. We have swam in the afternoons, but we don't keep it going like
and
we should.
What happens? What happens that...
We start, well, if one person has something to do one afternoon, then it kind of breaks the cycle, the pattern, and you just get out of the routine. It's easy to do with busy lives, isn't it?
It sure is. It sure is.
Excuse me.
Do you think there's things in the neighborhood or in the county that might cause type 2 diabetes?
It's a part of our lifestyle across the United States. The fast food, the busy lifestyle, and the fast food. It's a big problem, I think.
Do you think there's anything that we could do to prevent type 2 diabetes?
Education is the best tool that I know of to help fight it. Some people don't realize what does cause it, that their diet and not enough exercise is a big factor. In our schools, we have made a difference in the schools now in the state of Mississippi with changing soft drinks in the machines, and I think the cafeterias have tried to serve a healthier diet.
So you've seen that here in Winston County?
I have seen that here in Winston County. The kids were not so happy about the Cokes disappearing from the machines. But
so what's in the machines now?
they have water. I think they have juices, but they don't have soft drinks.
Are there other things that might happen at school to make them healthier places for children?
I think they need to have more exercise and make PE a part of the curriculum from kindergarten to high school. And I don't think that's a part of the curriculum now. Why
do you think that's not happening?
It used to be when I went to school, that was part of the curriculum as far as lower grades. But I don't know what the problem is there. I don't know why it changed. I guess not enough hours in the day.
Are there things, you work here at the courthouse, right?
Yes, ma'am.
So, do you have a wellness policy, or is there anything that you do?
We have a no smoking policy. We do have a wellness on our insurance, checkups and things like that. You have benefits. You
So-
get paid for healthy youth checkups.
So prevention, you can,
We do have
screening.
those. We do have those.
What about for actually joining a health club?
We don't have that.
Okay. Is there a health club here?
There are two, I believe, in Winston County.
Okay, but that's not in your wellness
It's
plan?
not part of our wellness plan.
What do you think is the most important thing people in Winston County need to know about type 2 diabetes?
I don't think people realize the seriousness of it when you have surgery or you have sores or any illnesses that you don't heal as well. I don't think people realize that that's a big factor with diabetes and how dangerous it is.
Mm-hmm. And how would we inform people about that? How could we do that better?
The education is a problem, getting the word out. Newspaper, radio ads, and then of course word of mouth. With the Diabetes Coalition group that has started, I think that will help to get the word out.
You have a lot of churches. And
We do, that is a good way to,
do you think that
the
would be a
word
way to?
that would probably be the best way to get the word out, is in the churches.
How would you do that?
With the Baptist churches, there's a Baptist ministry. There's a Baptist center here that we could get material to.
Mm-hmm.
Just get people involved, let them know about the Diabetes Coalition.
Is there a ministerial association?
There is a ministerial association, and that would be a good way.
Because a lot of churches are independent.
Yes.
How do we reach those independent churches?
And contact the ministers, I believe, would be the best way. And then ask for leaders in the church. Ask for names of leaders in the church, maybe.
Mm-hmm. Good idea. If you were going to make some specific changes, is there anything that you would start with? Where would you start?
The education, I think, is the most important thing.
Okay, let's talk a little bit about that. Who do we educate, and what do we educate them about? 2 questions.
Your older people need to be educated. I think the good way to reach them would be through the churches, because a lot of older people are not, they're not educated from school like we were when we went to school. We had a little bit of education on things like that with health classes that we had. Then the children in school need to be educated, just the same as they're educated on drugs.
Mm-hmm.
They need to be educated on diabetes.
Do most people in the county read and write okay?
I would say the majority do.
Okay. Do people understand what their doctors say?
Our doctors are always in such a hurry these days. I don't think we do get everything we need to hear
Mm-hmm.
from our doctors, because they're just so busy. They don't have the one-on-one time to sit down and explain a lot of things to us. So
How about
TV, radio.
How about nurses?
Nurses usually have a little more time, and that would be a good way to get the word out to
Okay.
patients.
Do you belong to any groups beside, you're working, so I know you're busy, but do you belong to any other groups in the community?
I belong to one group to help the needy with providing food.
Mhm.
That's just trying to get started here.
Oh, okay, so you're just getting started. And what do you think diabetes prevention might fit into what you think about that particular group?
Well, the food itself. We could make sure that we provide food or get the word out to the people that will be providing food for the pantry later on.
You have a food pantry here?
We're trying to get one started later.
Okay, so there isn't one right now.
There's not one right now.
Okay, and then you mentioned a couple of times here education. So how could we educate as well as feed?
Pamphlets maybe, with people coming in. Maybe even give them recipes that are healthy.
Mm-hmm.
Provide the foods that would go with, along with the recipes, that would be a healthy diet.
Mm-hmm. Would you, do you cook?
I do, not as much as I used to.
So you go home from work at night and you're tired, you know. So
Yes.
what do you know, how often in the week do you eat out for supper?
The majority of it.
Do you?
I honestly do. There just doesn't seem to be the time. Of course, right now it's campaign season, so
All right.
we're on the run.
So when you're eating out, are you getting fruits and vegetables in your diet, or?
I am guilty of eating all the wrong foods.
Okay, and this isn't to you know, be critical. I'm just trying to,
Oh, no.
I'm just
It's
trying to,
just
you know, get an understanding of what
realistic.
people in the community, you know, what's going on.
It is.
We have some real
reality.
problems in the nation, you know,
Yes.
and trying to understand what happens even in a rural place. People often talk about the cities, but I'm trying to understand what happens in the country, you know. So you still wind up eating out.
We do.
And when you cook, what does that look like? You're going to go home and cook supper. Are you going to cook supper tonight?
Well, I cooked last night.
Okay. So what'd you
It
have?
was roast potatoes and carrots. We had one part of our meal that's not so healthy, fried squash. So
But you did have roast
we
potatoes
did have fresh potatoes, corn,
and carrots.
carrots.
Okay. So
With a
fairly
pot
good.
roast, so it's the only thing was the squash that was not so healthy.
But awful tasty, right?
Very good.
Right, I think that's really all of the questions I have, but before we end, is there anything else that I didn't ask you about that you think it's important for us to think about as we're getting involved with this coalition?
I think the main thing is to let people know how dangerous it is for family members when they have diabetes to take care of themselves, the problems with the sores, the surgeries, the healing.
Mm-hmm.
Because I did have a family member that did die as a result of that. Could not heal properly.
And you're not involved currently with the Diabetes Coalition?
Time just has not
I understand.
allowed it right now.
But Janice has your number, you know.
Yes, ma'am.
Okay, so we may be looking to call on you as the group's just beginning to work on the strategic plan, and we have 4 years of activity that we want to really do some good things in the county. So we may be getting back in touch with you if you're willing.
To your call.
Appreciate that so much.